This is an interview question. You came to work one morning and we are asked to give personal care to residents who is dependent. But that day she cannot do things on her own. Please, how do you go about it? Okay. From your statement, this resident is dependent. Dependent, or do you mean to say independent? I think that is what you mean to say, because when you say dependent, it means they cannot do anything on their own, or most things on their own. They have to depend on somebody to do it for them, right? And when you talk of independent, it means they can do it on their own. Like this resident is independent. They take their shower on their own, they eat on their own, so you have to know the difference. So if you're talking about a patient or a resident who is independent, and that morning you come in, they're feeling so weak, they are depending on somebody, they need someone to help them, and they ask you to do it, what do you do? It is very simple. You go there, you ask them, what do you want me to do for you? How do you want me to support you? Do you want to have a shower? If they say yes, you help them and walk them to the bathroom and give them shower. Help them and come out and dress them up. Do you want food? What do you want? Because they are independent means they can even come to the dining. But that day they are not able to do it. So you bring their food or whatever to their room, you serve them in the room. So all you have to do that day is to support and support. Yeah, you have to support them, because that day they are dependent, they are no longer independent. I hope this is what you want to ask. That is what you have to do. If you take a patient out and they say they are not coming back and become aggressive, what do you do? This is like every day, it happens every day. So what you would do is that first of all, you have to remain calm. You have to remain calm. You don't try to force the person. It might escalate and you may not like the result, because side people might start saying, who is this person? Why is she trying to force this person to do something? Why are you forcing her to go home? Is this how you care for, So you have to avoid that entirely by doing what? Keeping calm. Then you have to ask, why don't you want to go home? It's time for us to go home. We finished with what we are doing or whatever. Just try to communicate calmly, politely, and understand what their concern is, why they don't want to go home. Sometimes they will say something, sometimes they will not say something. Then you have to inform the security in charge of that place so they can help and stop the person from maybe going to the road or endangering themselves. And the next one you have to do is to call your care facility, the person in charge, your supervisor or your manager. You have to call them and inform them on what is going on. And yeah, after that, when you come back, you have to document what has happened. That is what you have to do. So this question remind me, I've had a case like this where I took a resident to the hospital, and after the appointment, they refused to come back. They were saying, I'm not going back. I'm not going back there. They are black people, black men, beating me, punch. She was saying a lot of things. At some point, I became scared because somebody that have dementia coming to the hospital to start saying black people beating her, she's not coming back. That type of a thing. I was embarrassed because I don't know where she got that thing from. So the nurses came, they tried, no way. They brought someone that speak her language, no way. Nothing. The security in charge there at the reception tried to stop her, no way. She refused to enter the taxi. We couldn't get back home. So what I did was that I had to inform the deputy manager on duty that day, and he was like, call the police. Because at some point she went to the main road and started controlling the traffic. It was not funny. It was not funny. It was the police that had to intervene because she was almost taking off her clothes. In fact, I had trauma that day after that incident. Taking resident to the hospital again is a nightmare. Like, I don't like to do it. So, but some of them, they can say what is their reason. And when I came back, I documented what happened. and that is it. But you see that thing the woman was saying, black people, they are beating me. That was not nice at all, and it never happened. Such thing don't happen. So that is it. So my sister, that's all you have to do. Keep calm. Do not try to force them because it will escalate it. Call for help, call your home, inform them what is happening, and when you get back, you document what has happened. Can you tell me your experience as a caregiver? Okay, for you to answer this question, you have to focus on your experience, your personal experience, highlighting your skills, your responsibility, and if possible, your success so far you have achieved as a caregiver. Okay, you can start by telling them how many years you have worked as a carer, what your responsibilities are, your duties, people you have worked with, and you know yeah, so you can tell them that I have several years of experience as a caregiver or a carer, and I've worked in different care setting where I care for the elderly people who have got dementia, in nursing homes, rehabilitation home, private homes, in the community, anywhere you have worked at all. And this is where I give them support with their daily life activities, such as providing personal care, helping them, those that cannot feed, assisted feeding, support them emotionally, physically, engaging them in activities to help them keep up with their mobilities and social life. I have worked with so many healthcare professionals, such as social workers, doctors, and nurses. I've also achieved a lot of success working as a team in my previous place of work, where I bring out my opinions and using my initiative and everything come out good. Just tell them your experience, what you have experienced. You can also say that you are happy you have been able to build a strong and positive relationship with your residents, their families, and your colleague. Just tell them your experience. What have you experienced so far? So if it is me, this is what I would answer. I've had several years of experience as a caregiver, working in different healthcare settings. I've worked in the hospital, in a rehabilitation home, in a residential home, where I care for the elderly people who have got dementia, in a nursing home, you know, in a private living home in the community, where I support uh, these vulnerable people to have their shower, personal care, help them prepare their meal. Those that cannot feed, I help them, assist them in feeding, engage them in activities to help improve their social life, and also engage them, to improve their mobility. I've also worked with so many care professionals such as doctors, nurses, GPs, you know, social workers, and I'm happy because I've been able to build a positive relationship with the residents, their families, and my colleagues. And I'm happy being able to work as a team member have given me a sense of a sense of belonging, because I bring out my opinion and my ideas, and sometimes use my initiative, and everything works out fine. So yeah, I hope you understand what I mean. Tell them your years of experience, what you have, your skills, the responsibilities, what you have been doing so far, your responsibilities as a caregiver, people you have worked with, your success, if you think you have achieved any. To me, building a strong and positive relationship between the staff, that's my colleague, the residents, and their family is a very great achievement for me. It is a success because if you happen to be a staff that always have problem among your team, among the patients you look after, and their family members, you failed. So if you have done good in that aspect, to me, is a success. So what is your success? What do you call success? You have to think about it. Emphasize on your personal skills, responsibilities, and all that. Yeah, I hope this helps. How could you respond to someone who was making inappropriate comments? Okay, when someone is making inappropriate comment towards you, first of all, you have to address it. Yeah, you have to address it because they might not know. You have to address it, by saying something like, I found that comment inappropriate or disrespectful. Please refrain from using such comments in the future. I wouldn't like you to use such comments again in the future, please. You have to be professional. Professionalism, you have to maintain it. You have to remain calm, polite. You have to be firm. Even though you are calm and polite, you have to be firm while addressing it. You have to be firm. Let them understand that you deserve some level of respect, okay? And their comment is inappropriate. You have to be firm but polite, okay? Why saying that? And the next thing you have to do, if the person continues, then they're now becoming intentional. You may have to involve others. What do I mean by involving others? Maybe your colleague, supervisor, manager, or whoever you feel you should involve. You have to involve them. Then you also have to document it, because you can imagine in a place of work somebody will be like, I like your backside, it's so big. That is rude. It's disrespectful. Yeah, that is disrespectful. So you can actually tell the person, so sorry, I don't like that comment. I found it disrespectful and inappropriate. Please do not use it again. Don't say that comment again. Refrain from using it in the future. Refrain from saying that in the future, please. And some people, they might not know. When you say that, they might apologize and be like, oh, I'm sorry. If they don't and they continue, you have to be firm. Maintaining professionalism. Like, you have to be polite, calm, but firm. You understand what I mean? That, like, the way I'm talking to you, I'm calm, right? I'm not shouting at you. But you have to be firm. Please do not say this thing again. If they continue, you have to get someone involved. Either the manager, the team leader, or whoever that you think you should get involved. You get them involved, okay? And you have to document it for your own safety, because if, like example I use, somebody say your backside is this, one day they might have to spank your bum. Is that what you want in the place of work? Okay, it also extends to residents or patients you care for. If you have got a colleague that is making inappropriate comment towards them, you have to do the same. Address them. Don't say this again. It is not nice. Please stop. Okay? They might, if they don't know, maybe they said it out of excitement or whatever, they might be like, oh, sorry. If they don't, they are repeating it. You have to be firm, get other people involved, and document what has happened. Okay? Walk us through a time when you had a difficult client and how you handled it. Okay, I work in a dementia home, and most times they can be difficult, but I will give you the simplest one. Okay, I've got a resident who don't like to have personal care. They don't like to be supported with personal care. You approach them, they will decline. Okay, at some point it became a concern because they will make a mess on their clothes, but they would refuse to have a wash. And no matter who you send to them, they will refuse. They are ready to fight you. It was that difficult. So what I did was I started coming closer to him, to the resident. I became very close. In the morning I go to him, I greet him. I don't ask him about personal care. I will offer him food. I will offer him drink. Okay? And I continued doing it to the extent that he became very familiar with me. So once I enter his room, he will be like, hello, is it you? I've been waiting for you. Like, we became friends. And one day I was like, are you happy to go out with me? I want to go to the park. He said yes. And I said to him, okay, would you like me to give you a new clothes so you put it on and look good? So when we get to the field, people there will not, so they will be happy to stay with us and have a chat. He said, yeah, yes. I said, okay. I went and brought new clothes for him. So when I came in, I said to him, should I help put everything ready for you in the shower while I iron no while I get ready your dress, everything, your shoes, while I get them ready. For the first 5 minutes, he was like, no, I'm not going again with you. And I said to him, you said we are friends, right? I want you to go with me. Please, can you have a shower? Let's go together. And he said, okay, I'm gonna do that, And he went into the bathroom and he had a shower. And he changed his clothes. This is something that had never happened for the past 3 months. So, and I took him to the park. And he was very happy. So, find anything you feel that is common within resident that you care for. You can even say that you've had a resident who don't like to take medication. You give them medication, they will fling it from the window. They don't want to take it. Okay? You try to communicate with them to find out why. They are saying, no, it's poison, I don't want it. It's poison, I don't want it. You find what you did was, when you were coming to the resident, you made a cup of tea, you made a cup of coffee, you brought juice, that this resident likes to drink anything fluid. So you make as many as possible and you sit close to him or her, whatever, try to chat with them. On the process, you give them the medication, one after the other. So you just find something. This type of question, you don't need truth or false. No, paint scenario. When you paint a scenario, it might be true, it might be false. Like what I just painted, it might be true, it might be false. But they just want to see if you have if you have dealt with a resident who is very difficult, how you handle them. If you have encountered a resident that is difficult, how you were able to handle them to achieve a positive result. So I hope this helped. Or if you don't know what to paint, use the personal care oil that I said, especially if you have not started giving medication.